helping make your life easier. Moms Every Day.
Welcome to momseveryday.com. I'm your host, Jen Lennon. Today I'm joined by Dr. Andrew Hall. He is from the Studio for Exceptional Dentistry and is the dentist there. Nice to have you, Dr. Hall.
Thank you for having me.
And Dr. Hall, it was great to have you last time to learn a little bit about the studio, but today you're going to talk to us about straight teeth. What is it that you offer at the studio that's unique?
Well, we'd just like to discuss briefly Invisalign,
Okay.
and it's basically a clear alternative, if you will, to traditional braces.
Okay, so I think I've seen this probably advertised in places, but you actually wear something that people really can't see and it becomes the braces, right?
Right, exactly. It's just a clear, what they refer to as an aligner that you wear.
Okay.
And basically through that sequence, it straightens the teeth over time, just the same way braces would.
Okay.
It's just that it's obviously less cumbersome and easier for you to live kind of a more social, active lifestyle with it.
Okay, so how does that work? We're seeing some video footage here. How do they do this without tightening braces all the time?
Right, essentially what we do is we take a series of impressions, we send that off to Invisalign where they make these trays, which you see here, these aligners,
Okay.
which basically, say there's 10 of them, we walk you through 1 through 10, wearing them in a 2-week time period. And then basically we get the results like you see on the screen there.
Okay, so I see that it's a progression. You don't keep the same aligner the whole time. That would make sense then.
Right, 2-week
Okay.
intervals, and then we see you in the office about every 6 to 8 weeks. So it's not a huge time commitment either.
Okay, and you can do that all with computer imaging so that they can predict what these aligners should look like down the road. Is that right?
Right, and the patients can come in and actually see the beginning and the end and how it's going to look before we even start treatment, which is really nice and a nice motivating factor.
Oh, you can show them a before and after on their own set of teeth.
Absolutely.
Oh,
Yeah,
I like that.
Absolutely, yes.
Now, you said that this is fairly convenient. Who do you find usually likes the Invisalign? Who does it usually work well for?
Well, really, we find it works a lot for our adult population.
Okay.
Most likely somebody who maybe was even in braces as a child, maybe has had some relapse. And
Okay,
now
that's me right
all
here.
And now they want to correct that. Maybe,
Okay.
you know, maybe their smile isn't quite where they want it to be. And this is a very nice solution for them.
Okay, and what about, do you treat teenagers as well? You know, sometimes teenagers can be self-conscious about braces. Is that something you can do?
Absolutely. They actually have their own program, Invisalign Teen, which is available. So we can treat anybody from young adolescents to older adults, whatever. It's a solution for everybody.
Okay, and I know that, you know, it's a cosmetic solution, and that is important because your smile certainly makes an impression upon people, but are there really functional or health reasons to straighten the teeth?
Absolutely, and that's really the underlying factor why we pushed it in the office.
Okay.
Straighter teeth are easier to keep clean. They're more healthy. We can fix bite issues with it as well, which can prevent other dentistry that may need to be done due to breaking of teeth or fracturing of teeth or premature wear of teeth. So the functional health benefits is really what we're after. The cosmetic aspect obviously is what everybody wants, the beautiful smile, which
Sure.
we'll give you.
Sure.
But like I tell patients often, it's just kind of the icing on the cake sometimes.
Right, and so what's the first step? I mean, you've definitely intrigued me. What do we do? Is there a consultation process? How does that work?
Yes, just call the office,
Okay.
come into the office, and we love to do a complimentary consultation. We'll sit down with the patient, talk about if they're a candidate,
Okay.
roughly how long it may take for their treatment.
Because I'm sure that varies from patient to patient.
It does, each case is different, and then
Okay.
also the cost associated with it. And just from that initial consultation, we can give them all of that information.
Well, it sounds great. It sounds like it's a healthy option as well as a cosmetic one and not so disruptive to life, right?
No, exactly.
Thank you,
exactly.
Dr. Hall. I appreciate it.
Thank you.
And for more information about the Studio for Exceptional Dentistry, you can go to our website, momseveryday.com. Thank you for joining me today and every day. I'm your host, Jen Lennon, for momseveryday.com.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.